Hi, class. All right, we're at the last chapter, chapter 20. Death, dying, and grieving. It's an interesting chapter. You know, it's the one thing that we all have in common. We're all going to die at some time. And so when we look at it, what we see is that there are different death systems based off of different cultures. There's cultural variations. So Kastenbaum addresses in this chapter that every culture has a death system. There's usually components like people, places, time, objects, and symbols. Most cultures don't view death as the end of existence. They believe there's an afterlife. There's something that is going to occur after death. The U.S., we're more of a death-denying and death-avoiding culture than any other culture. We don't really embrace it. In fact, what we'll find out is that most people don't die at home. And that may be a factor that contributes to this. Maybe a factor contributing to this. All right. Again, when, where, and why people die has changed historically. In the past, we would die in the home. And now, we die in institutions. There's hospice care, which is a way of providing palliative care so that we're not in pain while we're dying. As a result of that, exposure to death is pretty minimized. There are certain issues in determining death the text talks about. Whoops, hang on for 1 second. There, my notes all organized here. Jumped up faster than I wanted it to do. Determining whether someone is dead was simpler 25 years ago. You listen, there's no heartbeat, they're dead. But now we know that the brain is actually the last thing to go. And so we want to see, are they actually brain dead? And so there's some debate about whether or not somebody who's on life support should be sustained in life support. Whether or not their brain is actually functioning as a component of it. Some issues, of course, with death are having a living will. Euthanasia, availability of hospice care. Those are all some issues that are brought up during this stage of life. Needs to be patient, guys, as I get my notes together. Causes of death, of course, in younger people, it's usually an accident. For the elderly, it's chronic disease. Attitudes towards death is kind of interesting. Infants don't have a concept of death. Attitudes changes throughout the lifespan. Older adults often show less anxiety about dying than do middle-aged adults. In fact, for some reason, I just have a lot of friends of mine that are much older. And one person that I swim laps with, he's 86 years old, was a very successful dentist, very active, and he says he just is tired. He says, I'm okay with dying. And so his view of death is not quite as scary as it is for the middle-aged adults. Facing one's own death, Kubler-Ross is probably the one who got things going here. Remember, she's got the 5 stages of dying: denial, isolation, anger, bargaining, depression, and acceptance. She had those 5 stages. People have added some stages. Some of them have taken stages away. One thing that she says, that they don't necessarily go in sequence. In fact, she was criticized. When she died because she didn't go through the stages correctly. But she was the first one to say that you don't have to go through those stages one after another. Let's see. Just glancing over my notes. Coping with the death of someone else, having open communication, emphasizing on the dying person's strength, the contributions that they gave to society, to their families. Grieving, it's multidimensional, can last for years, though prolonged grief may not be resolved. I had one client, and this was an example of prolonged grief. They usually say it takes about 5 years to become, for lack of a better term, somewhat normal after the loss of someone with whom you've had a long relationship with. And maybe I'm thinking more of like a widow or a widower. Prolonged grief is where there is continued grief much longer than you would expect. Most people say it's like 1 or 2 years. I give 5 years for it, but I've had patients of mine that have come in that 10, 15 years are still a wreck over the loss of their spouse. Usually in this one particular case was a woman who lost her husband. And that was amazing. I mean, 15 years later, she still was just a wreck. You know, she was pretty much cried for the whole 3.5 hours that I worked with her. Part of the grieving process is also how to make sense of the world, especially when a death is caused by an accident, you know, something, a sudden death. Let's see, forms of mourning vary across cultures. Funerals are important aspects of the mourning process, and again, it varies based off of the culture. And so with that said, guys, that ends chapter 20, or at least introduces you to chapter 20. Thank you again for your patience, guys.